A new report breaks down how health providers, police, and EMS respond to mental health-related emergency calls. It comes from a group seeking the best outcome for those who are in a crisis.
Now, that group is called the Crisis to Care Collaborative. Jane Mogavero is the executive director of the Patrick P. Lee Foundation, and Lisa Chimera is a deputy Erie County executive. Thank you for coming on in. Who would like to start first by reacting to this report, which was just released yesterday, and the major findings?
Well, first, let's talk about what Crisis to Care is. I think for the first time ever, we have individuals from law enforcement, individuals from government, philanthropy, and providers coming together to come up with a solution. And Crisis to Care is individuals experiencing a mental health crisis and getting the much needed care that they need.
Yep. So we have about 30 partners of the collaborative, and 10 of those partners gave us the data that we are presenting in that report. That might not sound like many, but to get 10 organizations to be transparent with their data and really show where our system is failing the community is critical if we're really to move forward in a meaningful way.
So looking at this report, it's very in-depth. There's over 55 pages, and you were telling us it took about a year to kind of look at everything and compile all of that data. What stood out to you the most?
Well, you know, I don't necessarily think that things stood out that were shocking because they looked at the data with three components. It was the calls, the response, and where individuals go. I think things that we certainly want to work on is the calls and the amount of calls that are coming in and are being perhaps coded incorrectly. Less than 3% of calls are being coded as mental health calls. We know that it's much more than that, so we need to improve upon that. I think that was something that was surprising and that we know that we can do better with.
Yeah, it seems like, oh, I'm sorry, I didn't know if we wanted to add on to that.
I was going to say, we, as a qualitative part of this research that we're doing, we did host listening sessions. And when you hear a family member talk about, how can I explain to my son that he's not a criminal when the police are showing up and he needs help? Like, those things don't jive. I mean, that's not what we would want for our people who are needing help. So in the call, the respond, like we said, there's so many opportunities for us to do better. The challenge with the system is that there's no one person in charge of it, and that's why the collaborative approach is what we need. There's the county, there's the city, there's the sheriff, there's all the behavioral health providers. So if we're not all at the table, we can't move forward.
To go off of that, since its inception, this collaborative, that's the key word, right? Collaboration here. What difference would you say having this established make when it comes to mental health response?
I think all these systems have different cultures to them, right? So getting these groups together to understand why a clinician might respond one way and law enforcement might respond the other, they're not wrong. They're just different approaches, and they're being called on to do different things. In the case of law enforcement, we're asking them to play the role at times of what a clinician should be doing. So understanding each other and understanding why those sort of breakdowns of communication happen. But really, I think that's the key, the communication. I sit in these working groups with them. Again, 30 active organizations participating, and now they're collaborating. Side projects are coming out of it, and joint grant applications and things that wouldn't have happened if we weren't all in the room together.
And you had mentioned about some of the findings, the coding being an issue. Also, it appears that short staffing is an issue as well. And I'm just reading from some of the other findings. Buffalo Police, they are dispatched on average more than once an hour to respond to someone experiencing a mental health emergency. So what reforms need to happen in order to address some of these issues?
Well, I think one of the powerful things that are coming out of this working group is opportunities to have these conversations and come up with solutions together. That has not happened before. So each group is responsible for coming up with solutions to what happens when a call is made, who's going to respond, how are they going to respond, what kind of training is necessary to make sure that response is appropriate, and where are they going to go? What best fits the need of that individual? Are they going to go to the hospital, or are they going to go to a crisis stabilization center?
Yeah. So one of the things that I am looking forward to is now that we have this data and we've established the baseline of where our system is functioning or not functioning, in the spring we're going to roll out our recommendations. So as I said, there are working groups right now pulling together. We met yesterday and the day before to sort of identify where are there opportunities, where can we move forward together, and then we're going to report on it to the community. Transparency is super important to the members of this initiative, including Lisa and the other members of leadership. So we're going to keep at it, but we're going to keep being clear with the community what we're doing.
Very quickly before we let you go, we're just about out of time, but if there is maybe a group out there or maybe an individual they want to share their experience, what's the best way to get in touch?
So we have a website, crisistocare.org, and we include any events that we're having. So like I said, those listening sessions, they can also send an email. We do encourage people that, it's not actively monitored, so if they have an emergency, they really should call 911 or 988, which is the mental health emergency line.
And by the way, you can read this full report.
Oh, yeah.
It's more than 50 pages long, so you can read it cover to cover. Where can people do that?
At crisistocare.org.
Wonderful.
Okay.
If you
All right.
at home missed any of this, we'll have the entire interview up on our website, WIVB.com. Lisa, Jane, thank you so much for taking the time to
Thank
join
you.
us.
Yeah.
Thank you. Happy holidays.
Thank you.